Waiting lists for planned surgeries have more than trebled since the pandemic.
And the government is warning it could take 3 to 5 years to clear the backlog unless something's done about it.
So it's launching a national task force to help speed things up. Health correspondent Lucy Warhurst reports.
Planned care surgeries are non-urgent surgeries like knee and hip replacements, but they're getting further and further delayed, and it could take years to catch up on everyone who's waiting.
If we don't change the approach, then it could be 3 to 5 years. It needs to be way quicker than that.
Andrew Little's announced a national task force to tackle it. The man with the plan is Surgeon and Chief Medical Officer of Counties Manukau Health, Andrew Connolly.
It is a huge challenge, but it's a necessary one because New Zealanders not only expect but have a right to the very best in healthcare.
Currently, they're not all getting it. In February 2020, 15,000 people had been waiting longer than 4 months to have their first appointment with a specialist. 2 years later, that was up to nearly 36,000, more than double. While the number of people waiting longer than 4 months for treatment has more than trebled, from just over 8,000 to nearly 27,000. The Orthopaedic Association says what the figures don't tell you is the level of unmet need in the community.
Of 100 patients who are referred for hip and knee arthritis, only 25% of those are actually going to get to see a surgeon to access surgical care. So the other 75% are returned to their general practitioners.
And the problem's not over. John McKee says all of his planned surgeries at Christchurch Hospital over the past month have been cancelled due to COVID, while the hospital has to focus on acute surgery. On July the 1st, our 20 DHBs will merge to become one public health system. Interim Health NZ Chair Rob Campbell says it'll enable them to tackle planned care from a national perspective, and it needs teamwork.
A lot of what we're doing in the health system is like 5-day cricket. It has to be planned and approached in quite a careful way. But there are some things that need to be dealt with like T20, where there are lots of runs to be scored and scored quickly.
And it promises to address inequities.
There won't be a single king hit. It will be a relentless focus on improving outcomes for Maori.
If we acknowledge he hua Maori, he hua Aotearoa, what is good for Maori will be honestly good for all of Aotearoa.
Andrew Connolly says it's about working smarter.
We can deliver greater benefit, and we can probably do it not only more efficiently but more financially responsibly than we are now.
Cutting the time people who need operations and appointments have to wait.
Kia ora, Lucy. So can the surgeons catch up, and how long will it take?
That is the big question, Mike. In short, Andrew Connolly says yes, but it's not just a case of catching up, but also dealing with new patients. And this is going to be a complete shake-up of the waiting list. Now, they wouldn't be drawn on a timeline, but Andrew Little did say that it would have to be less than 3 years. He's called for a complete review of all waiting lists. I know what you're thinking, another review, that's not what we need, but work is already underway, and a national plan for planned care is due back by September.
Te nā koe, Lucy.